like us, follow us, and be the first to know. This is the Comrade Show. Make Comrade Show way. Comrade Lante Oriente. Live on Facebook and YouTube. Like us, follow us, and be the first to know. This is the Comrade Show. Make Comrade Show way.
Yes, Edo people and Nigerians across the world, top of the moment to you. Very good morning, good evening, good afternoon to you, depending on where you are joining us from. This is the Comrade Show, and of course, this is the segment we call the Comrade and Friends. My name is Comrade Lante Igbomusa Orehi, and of course, with me, I've got the team. Talking of the Musketeers of the Comrade Show, the Comrade and Friends with me. They're going to join me to anchor today's program. Today's a bit different because we have a special guest in the house. And we have a very special topic that we are going to be treating. Let's not forget, today is the 16th day of January 2022. And I'm going to start by imploring everyone, appealing to you, share this broadcast because it's a broadcast I believe every adult would learn from. It's a matter that has to do with health. And information, basically that I'm very sure most people have no idea about. In fact, this program is going to avail me the opportunity of knowing something about this. It's critical. It's very important. Don't watch this alone. Get your families, get your friends, get everybody together. Share the broadcast as much as possible. Without wasting time, let me quickly bring on the Musketeers of the Comrade Show. I'm going to start by asking my brother, Comrade Pharmacist Austin Iremira, to say a word or two. Comrade Pharmacist, you're welcome to the show.
Thank you so much, Comrade Lamte. It's always a pleasure to be here and in your company. And to our top fans and our viewers, I want to say good morning, good afternoon, and good evening, wherever you are in the globe. Like Comrade said, today is 16th of January 2022. Wow, the year that started a few weeks ago or a few days ago is already 16th. Thank God we are alive. And today's show promises to be a very great one. I want to enjoy all our fans to stay tuned, enjoy it. Remember, it's the Sunday tonic. And what's our promise? Let's always share. Thank you, my brother.
Yes, thank you very much, my brother, coming from Austin Iremira. Yes, we equally have our brother in the house, the other musketeer of the Comrade Show. His name is Comrade Dr. Tony Agboansevaife. Comrade Agboansevaife, you're welcome to the program, my brother.
Thank you very much, my brother, Comrade Lante Igbomusa Orehi. I want to join yourself and Pharmacist Iremira to welcome all our viewers to the super show we have for every one of us today. It's a learning shop, and I'm really happy to be here. Happy Sunday to all our viewers worldwide. You are all welcome.
Yes, thank you very much, my brother. Yes, Nigerians, we have a special guest in the house, one that we are very proud of. It's a Nigerian, a medical doctor, not just a medical doctor, a neurosurgeon. He knows everything about the brain, about the head of a human being. And he's going to be taking us through some of those intricacies of the human body, some of those things we may not have knowledge about that we need to observe. But this time, it has to do with a connection between the other room that is talking about sex and, of course, the brain and hemorrhage and stuff like that. And so the question is, can sex, cause brain hemorrhage? It's going to analyze all of these things. I never knew it could. I still don't know if it does. But before much ado, let me quickly let you know that we are very privileged to have Dr. Douglas Emeka Oko in the house. Dr. Douglas, you are very much welcome to the program, my brother.
Thank you very much, Comrade. Thank you, Austin. Thank you, Tony. And I want to say a big up to the great work that you guys do. And I hope, greetings to the audience. I hope that this is going to be, the information that we're providing here is going to actually help people, empower people with information and all that. So, greetings, everybody.
Great, man. Thank you so very much, bro. We are privileged to have you. Before we go into the matter proper, I want to bring on Dr. Tony Agbons to give us a brief so that, we get to understand and know and meet who, and get to know who Dr. Douglas Oko is. I know that, Dr. Agbons is got that brief, just to introduce him properly. Over to you, sir.
Thank you very much, Comrade Lante. You will all agree with me that since the promo of this program went out in the social media space, everywhere has been buzzing. People have been calling us, sending us messages that, wow, so this topic is there, and people are really looking forward to today. So I am really happy as I present to us our special guest today. Douglas Emeka Oko is a consultant neurosurgeon and the CEO of Ashanti Graham Medical Company Limited. His subspecialist competencies are skull-based stroke endoscopic pituitary, neurovascular, and complex spinal surgeries. He leads a fantastic team that delivers complex neurosurgical care at the Nisa Premier Hospital, Garki Hospital, and Zitadel Medicals and Diagnostics, all in Abuja, Nigeria. Douglas is a foremost Nigerian health sector advocate, entrepreneur, motivational speaker, and youth empowerment mentor. He had his secondary education at Adolo College, Benin City. Then he proceeded to the prestigious University of Benin in Nigeria. Douglas has specialist medical training in the United Kingdom, and this saw him rotate through and spend time in 10 of the 31 neurosurgical units in Great Britain. Douglas returned to Nigeria in August of 2016, and since then, he has collaborated with other individuals and organizations to help push the frontiers and boundaries and raise the standard of complex neurosurgical care in Nigeria. Douglas' mantra has remained and will always be that the Nigerian patients are worth it. And I must say here and break the ice that just recently, Dr. Douglas Emeka Oko got a federal appointment with the Federal Medical Center Abuja. And I must say a huge congratulations to you, Doc. You are welcome to the Comrade Show and this segment that we call the Comrade and Friends. You are welcome.
Thank you very, very much, Tony. I'm almost wondering whether I'm the one you're actually talking about. I'm the one you're describing, but thank you very, very much. Basically, it has been my passion to actually try and do my own little bit within my own little space, to actually push the boundaries of trying to actually redefine what healthcare is like in Nigeria. We know the struggle. So hopefully God gives people like me strength and the health to continue to do the kind of work that we do.
You're welcome. You're welcome.
Thank you very much, Douglas. We are glad to have you. I just want to put this information out there. I think it's important I do because Ian is the people who speak English say that an error left unrefuted leads to intellectual immorality. It's important that we know our audience. Dr. Douglas Oko is the husband of one of our sisters, and that's talking of Dr. Loretta Oboroko. They are both medical doctors, and one thing I find fascinating about the two of them is that a human being has two heads. One is this one, and the other one is under. The one is specialized under, while the man is specialized here. So they work on the two heads of a human being. And so I think it's a very beautiful arrangement. And, and we thank them seriously for their service. But quickly moving forward, Dr. Douglas, can brain hemorrhage, can cells cause brain hemorrhage? For our audience, some of them may not know what is hemorrhage or brain hemorrhage. What is brain hemorrhage?
So basically, we all talked. You guys actually involved me in this like a week ago, right? and then we all said we're going to talk about sex and a brain hemorrhage. And of course, like you said, Comrade Antonio has also alluded to, the feedback in terms of, oh, you guys are talking about this, something about sex and stuff like that, has been really, people really want to know about it. So that's great. Brain hemorrhage just means a bleed into the brain, okay, or into the casing of the brain. That's what it means. So the big question here, and it's also a very interesting question, isn't it? That can the fact having sex, can it actually cause someone to actually bleed in the brain? Because that's really scary stuff, isn't it? But let me start by saying this first of all, that sex is a pleasurable activity, yes, with couples. And it's really important for enjoying life, quality of life, and even health as well. So by the time you now start linking sex, that is a pleasurable activity, to actually something that is as sinister as a bleed in the brain, of course, people are going to ask questions. Wow, this thing that we enjoy and all that, you mean it can cause this? And there's bound to be a little bit of fear and stuff like that. But what we want to do here is to actually provide information around this topic of sex and something happening in the brain and all that, so that people are empowered with information and they know what to do in terms of, what kind of symptoms can happen with sex and something happening in the brain. What should they do if something happens like that, and what you can actually do to prevent it. So basically, that's what, in a nutshell, what I want to be talking about today, basically.
So importantly, hemorrhage or hemorrhage, what has to do with bleeding, in the brain, right?
Yes.
That's what you just explained.
Definitely.
So I'm not able to understand that. So if the brain they bleed, now the hemorrhage, and choke can cause this matter. Over to you, Austin Remiran. What question do you have for my brother?
Thank you so much, Dr. Douglas Emeka Oko. I think it's great for you to be here. I can see interesting conversation already going on our segment, and people are asking questions. I just want to go straight and ask you the question again. Can sex cause brain hemorrhage? Please fire away.
Okay, fantastic. So good. First of all, I'm sure people would like to know things about, like, can sex cause brain hemorrhage? Okay, what's even the cause? Okay, what are the common associated factors? What could predispose to this in the first place? So we'll start from there first. Okay, so what I'm going to be talking about is a spectrum. Okay, we'll look at actually having headaches during sex, okay, from the point of view of something that can be benign, not really serious, and moving all the way in the spectrum to headaches that can be something really sinister, okay, something that can be really life-threatening and sinister. So we're going to look at that whole spectrum. So at the benign or simple or not too dangerous spectrum is actually having headaches associated with sex. Okay, that's on one corner. At the other severe spectrum is actually sex actually being associated with a bleed in the brain. Okay, so remember, on this side, we're talking about headaches happening with sex, during sex, and then moving all the way to the dangerous spectrum of actually having a bleed. Okay, so I'm going to be talking about this whole spectrum and talking about things that can predispose, what kind of symptoms the patient can actually have, or the individual who this kind of thing happens to, and also what you do if it actually happens. Where do you go to? You go to hospital, you stay at home, and what we can actually do to prevent it. Okay, so primary headaches during sex. Okay, let's talk about what are the predisposing factors. Okay, what are the things that can be associated with it? Key things are people who have things like migraine. They are known to actually have migraine headaches. They are known to have tension headaches that are associated with stress. Okay, they are known to have headaches that are associated with physical exertion. And I'll give an example of what physical exertion I'm talking about. For example, people who, when they cough or when they are straining each other, they laugh, or somebody they sneeze. They actually feel, those people who feel those kind of headaches, it can be associated with people who actually have headaches when they're having sex as well. Okay, so I've talked about migraine, tension or stress headaches, and then exertion headaches as well. Okay, the other things that can be associated or predisposed are looking at the spectrum, or even looking at the spectrum going to the other end, where you talk about a bleed when someone is having sex, are the standard things that can cause people to actually have abnormalities in the blood vessels in their brain. Okay, and what are those things? Smoking, high blood pressure, diabetes, being overweight. And you can see that most of these things that I've enumerated, they are lifestyle choices, isn't it? Okay. So those are some of the risk factors. There are also drugs as well that are implicated, some kind of drugs and substances. Marijuana, okay? Marijuana can actually predispose to people actually having headaches while they're actually having sex. The common drug that we know as a sex stimulant is what do you call it? Viagra. Okay, so actually Viagra can actually predispose to actually having headaches while doing sexual activity as well. It's an interesting thing. There's an article, really article nicely done by one of my colleagues, Kanu and colleagues. Okay, Kanu is actually a neurosurgeon and actually did this article, or did this review article, or did this work with some pathologists who are actually morbid anatomists. They're the ones who actually do autopsies. You know, when somebody dies and they say, oh, let's try and find out what killed the person. So they actually did this work and they actually looked at 13 cases, okay, over 7 years between 2006 and 2013. And in these 13 cases, it was what we were looking at were people who actually died while they were having sex, sudden death when they were having sex. Now, out of these 13 people, out of these 13 cases, all of them were male. All of them were male. And so when they did the autopsy, they found out that the cause of death in this 13 men, all of them were what we call subarachnoid hemorrhages. Okay, subarachnoid hemorrhage is just a bleed around the brain. Okay, and about 10 of these 13 people, actually, the bleed was from an aneurysm. An aneurysm is like a weak spot on the blood vessel in the brain. Okay, so that's quite significant, isn't it? The interesting things that they actually found in this, looking at these 13 patients, is that a significant number of them, that this sexual activity that was being carried out were extramarital affair sexual activities, and they were outside the matrimonial home, or outside or locations that were outside the matrimonial home. So some might think,
Dr. Douglas, sorry, I don't want to match your tongue. I don't want to,
yes,
because this program, people when go school they watch them. People when not go school still they watch them. You know, so some of the grammar, some people may just be watching. They're not going to pick us small.
I will try break them down. I will try break them down because the information I'm giving is really interesting, isn't it?
Yes. When you talked about extramarital just now, if everybody if you don't know what to be extramarital,
people when they play away game,
away match.
Away match.
Okay, that's
so stadium.
They're going to get another girlfriend for us.
Bam. So when I talked about out of these 13 people, so where these 13 men were die. So okay, I think their age range was between 36 and 60 years. Because out of 13 of them, if all the 13 of them now bleed around the brain, which they call subarachnoid hemorrhage, what they call subarachnoid hemorrhage, that's what caused the death of all these people. And 10 out of these 13 people, they found out that they actually have a brain aneurysm.
And how many of them were playing away matches?
Well, they didn't, in this particular one, they didn't give specific data, but they say a significant number of them were found in, when this sexual activity was found in hotels or locations that were outside the matrimonial home.
Now, could it be, sorry, sir, could it be that some of those deaths we will see on Facebook in Nigeria, say man down top of woman for hotel, could it be that this may have been the cause?
In fact, one to answer that question, one of the articles that I actually looked at states that for about 50% of individuals who actually present to the emergency room in a hospital, because while they're having sex, about 50% of them have to do with something, a bleeding in their brain or something happening in their brain. 50%, significant number, 50%.
Doctor, okay. I want to ask you a question, Dr. Yes. Douglas. I am very much enjoying the way you are, breaking this, analyzing this matter. From simple biology, we all did the secondary school. We all know that during the sexual act, there is blood rush, increased blood flow, there is intensity, both from the male and the female. So these are natural processes. So what is now the link here? That because of course, if somebody is having sex, blood pressure must rise.
So
what is
the
link?
key link?
Tell us this link.
Yeah, so I talked about a few things. Remember, I talked about a spectrum, isn't it? I talked about looking at people who, when they are having sex, they develop headaches. Okay, and then that's sort of the benign spectrum or the simple part of the spectrum. And you cannot move all the way to the other end, which is sinister, which can actually have people having really bad headaches, and then you have something sinister happening. I'll describe the symptoms. That this book can present with. But I've talked, especially for the benign bits, I've talked a little bit about things that can predispose. Because I've talked about the people who have pre-existing, what do you call it, migraines, tension headaches, vexational headaches, and stuff like that. Talked about drugs. Talked about other key things like there's like the lifestyle modifiable factors, things like high blood pressure and stuff like that. So those are things in terms of predisposing factors, associated factors. Okay. Now, if you want to go straight into things like looking at the sexual act, for example, where you can now look at symptoms or look at the sexual act and the kind of things that happen within the human body during the sexual act. That's not a bad idea. So let's look at the sexual act. And there are about 4 stages or phases in the sexual act. The first one is the initial arousal stage, okay, where you have excitement and stuff like that. And then you now move to the second stage where you have more arousal, and then you get to what we call like a plateau. Okay, so in the initial stage, the third stage is when you actually have orgasm, and then you have the resolution where everything dies down. Okay, so if you look at that initial stage of excitement, what are some of the key things that happen with the body? Okay, there's excitement, the heart rate in terms of how fast the heart is beating goes up a little bit, heart starts beating a little bit faster, your breathing pattern, you start breathing a little bit faster as well. The muscles become, the tone of the muscles, the muscles start contracting, okay? And of course, the blood pressure starts going up a little bit as well. Okay. By the time you get to that second stage where you have the later stage of arousal, it's like a plateau. You are at that plateau stage. All these things in terms of the heart rate, the way
So what is a plateau? Because I hear just plateau.
Okay, so I'm going to use it like a slope, isn't it? So you start from initially, okay, you have the initial the excitement stage or the initial arousal stage, and then you're moving up, okay, and then you get to that stage where you have the full arousal, and then you're not moving, you're not moving up anymore. So that's the plateau, okay, and then from the plateau you now get to the point where there's orgasm. Yeah, after orgasm, everything dies down. Okay, so
very fast too.
You say I like that. So, but basically, what I'm saying is that as you're moving up from that initial arousal stage and you're moving towards the plateau stage, all these mechanisms in the body are going on in terms of what's happening to your heart, what's happening to your lungs, how you're breathing, the muscle tone on your body, and the blood pressure. Okay. By the time you now get to that stage of orgasm, okay, the blood pressure really shoots very, very high. The body is, the muscle tone, I can describe it as a tonic muscle tone, where the muscles become really, really stiff. And then after that, everything just goes down. Okay, so now the key question you're asking, Tony, is that how can you actually link that to people having headaches and stuff like that? In just headaches alone, okay, where you're just having sex and having headaches alone, what happens is that while the blood pressure, the pulse, and everything are slowly going up in that initial phase where you're going to the plateau phase and stuff like that, the headaches, people who actually develop these headaches, the headache starts initially during that period. It just goes up, the headaches in terms of the intensity and stuff like that. And then as the patient has orgasm, the headaches are worse. Becomes really, really, really bad. They're like, headaches. And then in that particular subset of patients, the headaches after some point actually dies down. Okay, so we're talking about symptoms now. The headaches actually die down at some point. Maybe usually within 24 hours. It can be within the next 2 minutes. It can be within the next 6 hours or so. Okay, usually people who have those kind of headaches, they usually have it at a period in time in their life. Okay, so sometimes it might just be maybe for 2 months. Okay, some people can have it for 6 months and then just have it maybe intermittently, maybe every 2 weeks and stuff like that. But the key thing with those sort of benign, simple headaches is that at some point it disappears. Usually, at some point it disappears. Okay, now that is the benign aspect of things. That's the benign aspect of it. It's simple, straightforward. Yes, people will be worried. Why am I having headaches when I'm having sex? Okay, but I've described usually what will happen. The pattern is that. Now let's go to the other bit, the sinister side, the one that we are all worried about, isn't it? Because remember, we're talking about sex and brain hemorrhage. Okay, now what are the things that might be the underlying problem where you now have sex being the precipitating factor? There are things actually underlying already. The sex is just like it's just like the trigger. Okay, that's the word, trigger. Okay, so the key things are patients or people who actually have underlying problems with blood vessels in their brains. Okay, the most common one is one that we talked about when I talked about this work done by Kanu and his team, and it is brain aneurysms. brain
What
aneurysm.
is aneurysm?
So a brain aneurysm is an abnormality on the blood vessel in the brain. Okay, remember the brain, usually we describe the brain as a bag of blood. In fact, the amount of blood, the percentage of blood that goes to the brain from the heart is almost about 20%. Once the heart pumps like this, about 20% of that blood goes to the brain. That's how important the brain is, the master organ of the body. So both the blood vessels just at the base of the brain. Okay, usually that's where you have the aneurysms. So if I'm to describe an aneurysm, imagine a pipe. Okay, imagine a pipe that's carrying water. Okay, and at some maybe the pipe goes there, and you can have a pipe dividing like that. Usually at the junction where the pipe will divide, you now have like a balloon or a weakening of the wall of that balloon, isn't it? Okay, so imagine if you have that kind of pipe with a weakening at some point, and you actually increase the pressure of the water that's going through. What will happen to that weak spot? It bursts and water comes out, isn't it? The same thing with the blood vessels in the brain. Okay, when you have people who have brain aneurysms like that, and anything that actually raises the blood pressure, it can what can happen? Wow, it can burst, isn't it? So that is the mechanism. So brain aneurysms are the most common one. Remember what I talked about the work by Kanu and his friends. That 13 of those patients that they looked at when they actually did the autopsy, they found out that 10 of them actually bled from an aneurysm. 10 of them. That's about 80% of them. Okay, so those men actually had the underlying problem of a brain aneurysm. So that's really important. So if you look at that those phases of the sexual act, and you see where there's excitement, the initial arousal, and then you're now moving upwards. Okay, your heart begins to beat faster, you're breathing faster, the tone in your body, and then you not get to that point. Usually the bleed usually happens during orgasm, because during orgasm the blood pressure shoots up. I remember the tap. Remember the tap? You understand? And the weak spot and stuff. So during the orgasm, it's like opening up the tap, high pressure, pow, and it interrupts.
And at that time, man has no control. But let me quickly ask this one.
Yes.
Because this one, I'm really scared, because some of us would enjoy this matter well. You understand what I'm saying now? We don't pretend about it. One of the most beautiful things when God created this world with, this area, very important.
Yes.
Should we
Comrade, it's sex.
It's sex, yes, it's sex. Yeah.
Comrade, he hit the nail on the head. Mention the thing.
Oh no, but it is true, man. There's no prison. We are adults, and I expect that people who are sharing, and families watching, their adult families, and all of that. This is not X-rated program for not for children. So the question size is, as beautiful as sex is, as enjoyable as it is, with all these small things when we hear now, should we be afraid of sex?
So the key thing is that, for example, let's use some data. The most of the research work that I've looked at, or the articles that I've looked at, or the reviews that I've looked at, say that roughly about 5 to 10% of patients who have bled from aneurysms, that it was during the sexual act that they actually bled. 5 to 10%. Okay, I don't know if I can put that number in context. So the key thing is, it's not like if everybody who has aneurysm, you understand, will bleed, but it's just good to know that there's this thing that sex. Again, let's look at a background or something. While, like you rightly said, sex is pleasurable, really good for quality of life and all that, sex is actually physical exertion. It's actually strenuous activity. Okay, especially depending on things like maybe the positions or the styles that people are using and stuff like that. I'm sure we've all heard of stories of maybe elderly gentlemen or whatever with young ladies and they're doing harder, faster and stuff like that. Okay, so this sex is actually strenuous activity. Okay, it's pleasurable activity, but it's also strenuous as well. And I've given you an idea of the kind of things that can be happening with the different.
When you miss strenuous, some of us may want to understand what do you miss strenuous? Saying a hard work.
Well, it is hard work.
Sex.
It is hard work. Definitely, it is hard work.
And
it is hard work. If you remember, like you rightly said, well, adults here, when you actually have sex and you have orgasm and stuff, what happens next to you?
Tired.
And then you go relax.
Sleep.
Exactly. That tells you that, it's really strenuous activity. It's enjoyable activity, but it is strenuous activity as well.
Dr. Douglas.
Yeah. Tell me.
That is why my wife always complains that after it, I just go to sleep.
Yes. That's it. So, but the key thing is, like I said when I started initially, I said, yeah, most people will be scared. Ooh, this thing that's pleasurable and everything. You mean it can cause a bleed in my brain? So the link is this. It is not that the sex itself is what will actually cause the bleed in your brain. Okay? The sex itself, depending on the individual, can cause headaches. Okay? Can cause primary headaches. And I've given you an idea of patients who are, or people who are actually predisposed to that. People who have some actually concomitant or other pre-existing problems. And I can mention them again: migraine, tension, headaches, and stuff like that. Stress. Do you understand? All those things. They can actually give rise to someone actually having sex and actually developing headaches. But in terms of having a bleed in the brain, sex itself does not cause a bleed in the brain. I don't know if you understand. Sex itself doesn't cause a bleed in the brain. It is the underlying issue, the underlying problem that a patient has, that the sex now becomes a trigger for a bleed in the brain. Okay, I've talked about aneurysms. I don't want anybody to forget aneurysms, but there are other things as well. There's another abnormal blood vessel problem in the brain called an arteriovenous malformation, an AVM for short. Usually, when the heart pumps blood goes through the high pressure blood vessels called the arteries. Okay, they get to a point where there's dampening through what we call the capillaries that actually send blood to the tissue and all that, and they then now go back to the heart through what we call veins, which are like low pressure blood vessels. Back to the. In arteriovenous malformations, one of the major problems there is that you don't have those capillaries that are dampening the pressure of the blood. So you actually have an artery going directly into a vein, and it's an abnormality that can be in the brain as well. So if one of the things that can happen is that if you have high pressure coming all the way from the artery and going straight into the vein, remember the vein is it's built in a way to actually receive blood under low pressure from the capillaries. But if you now have an artery going directly into the vein, it can rupture. Okay, so that's another thing again. You can have a patient having a pre-existing problem, having this arteriovenous malformation, and then they are having sex, and then they bleed again. The third one is what we call blood vessel dissection, okay, or an arterial dissection happening in the brain. And I'll explain that. Remember, we're talking about the blood vessel has a wall, isn't it? You have the blood flowing through it. With pressure, with very raised blood pressure and stress and all that, you can actually have that wall tearing, okay, and blocking up the blood vessel, and you can have a stroke. You can have actually a stroke with that, where because the wall of the blood vessel has been torn and it now goes into the canal where the blood is rushing, it now blocks it, and then that particular area of the brain where that blood vessel is supplying, it also doesn't get blood, and then you can actually have a stroke. So, like I said, the commonest thing is in terms of a bleed from in the brain from having sex is an aneurysm, but you can also have an arteriovenous malformation and an arterial dissection as well. But the key one, the most common one, is an aneurysm.
So, Dr. Douglas, I want to quickly chip this one in. And a lot of our viewers are asking this question.
Dr. Agbos, before you come in, I want to appeal because we have a lot of questions from our audience.
Let them call in.
So I want to know, people can drop questions on Facebook and YouTube, and if you want to call, you can call in. The number is displayed on the screen. Doctor, I want to appeal. Say the questions now. Want to treat public questions right now, okay?
Let's rock and roll.
If you can be very concise, just hit so that we will take as many questions as possible before.
I'll try my best, Comrade. So hit me.
Yeah. So the question I want to ask, thank you, Comrade, for that. This you were talking about orgasm and all the rest. Is this thing actually just related to men only? How about the women's side? Let us hear that side.
Okay, key question. I think I actually talked about it when I was talking about predisposing factors. So it happens in both sexes. It happens in all ages who are involved in sexual activity. Okay, but more of younger middle-aged people. Not so much in elderly people because they don't do especially sexual activity that is really exertional and stuff like that. They probably don't have the strength as much compared to the younger people. But generally, for some reason, it happens more in males. Okay, it happens in females as well, but it happens more in males. Trying to actually find out why it is. People have done a little bit of research, but it's not clear-cut. For example, we talked about the orgasm, isn't it? And then you having the spike of your blood pressure during orgasms. Usually, a man has orgasm just once during a particular sexual act. A woman can actually have multiple orgasms, isn't it? So you would think that it should be more with females, but if you look at the data and all that, usually males, but definitely it happens in females as well.
Okay, Dr. Douglas, mine is more of a contribution And it may also be a question. Because it looks like in this whole matter, the men are the ones really suffering the more.
Well, in terms of what the data and the statistics are showing, yeah.
Sort of. Somebody has argued before that we take a lot of time to engage our women to come. I think by this statement, I want to appeal to our women out there as well. As soon as the man begin to make noise, I think it will support so that it doesn't have a strong delay. Because when all those things are firing, sometimes overfiring can cause problem. So the women need to also help us. What do you think, Dr. Douglas?
Well, I think basically, okay, remember I talked about predisposing factors. I talked about predisposing factors. So let me give like a sort of picture. Okay, imagine a 65, 66-year-old gentleman. Okay, maybe he's widowed, or maybe he's from the part of our country where you can marry two wives. Okay, and he marries a lady who is about 30 years old. Okay. If that lady wants to help that gentleman, okay, that issue of faster, harder, probably we should look at it a little bit, okay. Of course, when during the sexual act itself, you actually have the two people involved, and usually one person is playing an active role and the other person is playing a passive role, isn't it? Okay, so in this sort of scenario, a 65-year-old man, a new wife, 30-year-old man, maybe the lady should be playing more of the active role in terms of when you look at the when you actually have sex. That might actually help the elderly gentleman in terms of actually trying to prevent any issue in terms of his health that can happen with sex as well. So those are just some of the common sense things that we should actually look at. I hope that sort of helps a little bit in terms of answering your question.
One sister, Ize Okojeyamu, wrote on Facebook, I think. She said women equally have bleeds, in the brain, but estrogen protects them,
And I totally agree with Isaac. Remember, we talked about statistically, it happens more in men, but it definitely happens in women. And what she's just saying is that estrogen is actually is a sex hormone. Okay, it's one of the chemicals that makes you in your body, that makes you a woman. Okay, and you're saying that generally that chemical is protective for women in terms of looking at how the blood vessels and stuff like that. So it just means that if this chemical, for example, estrogen, as women grow older, the level of this chemical, the concentration actually reduces. Okay, so you find out that when elderly women who are actually the older women will actually present more with problems regarding their blood vessels in their brains or anywhere in the body compared to younger women. Does that make sense?
Yeah, Dr. Douglas, just a quick one.
Yes.
Because I'm just looking at what our viewers are putting on Facebook right now. So, what is the impact of sex enhancement drugs? I know you mentioned Viagra. So, how does that one come in as well in this hemorrhage thing we are talking about?
I think if you can link that with basically the fact that sexual activity, like I already said, is physical exertion. Okay, anything that makes you have more of that physical exertion, that kind of activity and stuff like that, will definitely predispose you more to actually have these kind of problems. Also, some of these drugs as well can actually affect the blood vessels, be the blood vessels in the body or the blood vessels in the brain as well. They can actually affect for the headaches, for people who have mainly just headaches and they don't have a bleed. Okay, one of the mechanisms that they talk about is not confirmed. They talk about is that during the sexual act, some of the blood vessels in the brain can actually start constricting and closing up. Okay, that's one of the mechanisms. So in terms of the drugs, some drugs can actually cause that as well, and actually predispose to actually having headaches. Okay, headaches during sex, not actually having a bleed per se. Remember, we talked about that spectrum where you're just having headaches during having sex, all the way to the sinister spectrum where you're actually having a bleed in the brain. Okay, so drugs, you understand, the way they actually work is either maybe to increase the exertion, increase the excitement, okay, and also they can actually work on the blood vessels as well.
Dr. Douglas, there's one question I want to ask. This one, because I'm looking at this career aspect of it. You are portioned about 5%, when you are portioned percentage.
In terms of patients who bleed specifically from aneurysms.
Yes, that's specifically.
A patient who bleeds from aneurysms, about 5 to 10% of them, the bleed happened during the sexual activity. So 5 to 10%. So it's not 60%, it's not 70%, it's just 5 to 10% of just those particular subset of patients.
That's what I'm saying. The question I'm asking now is that how many, percentage wise, how many men, okay, are in 100 are susceptible to aneurysm? like you mentioned?
So basically, if you look at brain aneurysm specifically, okay, it is said that about 2%, a whooping 2% of the population generally, anywhere, okay, have brain aneurysms. 2%.
So
Okay,
which means that
now,
those 2% can actually have hemorrhage during sex.
it's possible. But what we're saying is that generally, from studies that have been done, about 5 to 10% of those 2%, you understand, over 5% of those 2%, you understand, can actually, if they bleed, it can be during sexual activity specifically.
Okay, good. Now I'm leading somewhere. In that case, as a man, how do I know that I have or have not a brain aneurysm?
Okay, so your question leads me to the next thing of talking about, you understand, symptoms are actually moving to what do we do? Okay, you're having this kind of symptoms. What kind of symptoms would worry you in the first place? Okay, but again, I'd like to actually paint a picture. Okay, and I'll use the worst case scenario. Okay, so imagine young man, lady, they're in their room, they're having sex. Okay, and of course they're naked, isn't it? And then the man is on top, they're having sex, and all of a sudden, as the guy is having orgasm, he just shouts, "Yeah!" Bah! You understand? And from there, he starts having seizures. And as he's having seizures, he just collapses. Okay. Now, seizures, convulsions. Okay. So just the man has passed out. He's had convulsions. Picture the lady. Okay. Remember, they are both naked. They are in a room. They are just the ones there. Imagine how frightening and embarrassing that will be for the woman. Just picture it for 2 seconds. Okay. So what should she do? She's naked. Should she shout for help? If she shouts for help, if somebody comes in, both of them are naked. So the question is that in this,
and especially if it's extramarital affair, it's even dangerous.
Exactly. So what do you do in this kind of, so let me start from this worst case scenario and try and build up what should you do in this kind of scenario. So first thing, if it's possible, it's difficult, be calm. Okay, always ABC, always be calm. So I'm talking to, it's either a woman or a man, but we said usually it's men, isn't it? So the woman should be calm. So the first thing she does is that the man is on the, of course, he pushes the man off her breast, and then she rolls the man onto his side. Okay, onto his side. Because if the man has a seizure again or whatever, if you're lying on your back, you can actually aspirate, and then that's death. Okay, so you roll the man on his side, because you get something like a snapper of the pot, cover him up, make sure you yourself, you try and be as decent as possible, and then you now call for help. Does that make sense? Sometimes I like being practical. Okay.
Yes.
Now let's go back again to simple and all the way to complicated or sinister. Okay. Patient is having, a couple of times, patient is having sex during that phase where they're going up to the PT phase, having headaches, has orgasm, and has lots of headaches and stuff. Okay. If it's the situation where usually the headaches actually comes down and stuff like that, of course the person will be worried. The advice for such a person in terms of what you need to do is actually go see the doctor. Okay, go see the doctor. And who do you see? Well, you can pass through in places like UK and US and stuff like that. Yes, you can go through your general practitioner, your family physician, and stuff like that. Okay, Nigeria, you can try and do that as well. But the go-to person is actually the neurologist. Okay, neurologist. Sometimes people confuse a neurologist and a neurosurgeon. I'm a neurosurgeon, so I actually do operations on the brain and spine and all that. But a neurologist looks after patients who have medical conditions that affect their brain, their spinal cord, their nerves, but they do not do operations. Okay, so see a neurologist. Now, so what would the neurologist do for you, or any doctor who sees you? The first thing they'll do a proper assessment, and that assessment will include them actually talking to you, checking the history from you, finding out, has this been happening for a long time, all that. Okay, and then they also examine you as well. They might do some blood tests, some tests to check your heart and all that. Okay, they might do some general tests to make sure that you're generally a healthy person. You check your blood sugar, make sure that you're not diabetic, you check your blood pressure and all that. Okay, they will now decide whether they need to do a brain scan or not. Okay, there are two types of brain scans. There's a CT scan and an MRI scan. Okay, usually if patients present in this benign, simple aspect, there'll be a tendency more to do actually an MRI scan. Okay, so that's on one spectrum. Now, what's the second spectrum? The second spectrum is the picture that I actually painted on the sinister side, having sex, and all of a sudden, pow! You understand? It's like if somebody holds a hammer and knocks you at the back of your head, right? And then you can have different symptoms. Either person complaining of lots of headaches, with lots of neck pain and stuff like that, feeling very, very unwell, all the way to having seizures or convulsions, or actually passing and becoming unconscious. Okay, so what do you do with that? Okay, in places like UK and US, it's simple, isn't it? You pick your phone and you dial 999, 911, or whatever, isn't it? Okay, in the UK. Now, I'm sure there are lots of Nigerians who are on this forum now actually listening. And me, one of the things I tell you, I'm very pragmatic. Okay, so in Nigeria, can you pick up your phone and dial 911 and stuff like that? When you talk of emergency medical services and ambulance services in Nigeria, it's almost non-existent, isn't it? So that means what we are doing here is actually trying to empower people so they actually have the information so they can run with it when they actually run into trouble like this. Okay. One of the first things I would like to say is about capacity of our healthcare facilities. One of the things that I notice most of the time is that when people actually run into trouble, most in different parts of Nigeria, when they run into trouble, they just simply say, hey, let's go to hospital. Okay. Most of them do not know that the different hospitals have different capacities in terms of looking after patients. Okay, so if you have a patient, if you have someone who is actually in this kind of sinister condition and stuff like that, you need to go to a hospital that has capacity to actually look after such a patient. And time is of the essence. Okay, one of the things we always say is that time is brain. Time is brain. So that patient should not be moving to that next private hospital just next to them. They will say, well, let's just go to the hospital. Because the problem in Nigeria is that when you go to that private hospital that's just next to you there and stuff like that, they will actually accept you. You know why?
They want
you
money.
know, money, isn't it? Let's make our own. But the problem is that when you go into that private hospital that's next to you, time is going, and every time that you waste is important. So the first thing I will say is that when you have a patient who's in a very bad shape, having sex, has what we suspect is a bleed because of those very severe symptoms that the patient has that mentioned, please go to a hospital that has capacity to manage a patient who has such an emergency, serious, severe medical condition. And usually, like the teaching hospitals and like the general hospitals are the best. Preferably a teaching hospital. Okay, you move straight to their A&E or their emergency room. That's extremely important. Please, ladies and gentlemen, audience, if you have anybody, not just a patient who is having sex and has this kind of significant severe symptoms, anybody who you are told you think that looks like an emergency. Oh, I suspect this might be a heart attack. Or I suspect this might be. Please go to a hospital where they have capacity, and like I said, teaching hospital, federal medical centers, and probably maybe depending general hospitals. And there are also private hospitals that have capacity as well. Okay, there are also private hospitals that have capacity as well.
Okay, but before I go to the next one, sir, I just want to read out what Izemia Okoje Yamu said. I think she's a medical
It's a gynecologist.
A gynecologist. If one has persistent headaches with visual changes outside of having sex, go and see your doctor. It's very important. If you get headache, where, and sometimes go like say your eye they turn, make you try, make you go see doctor. Whatever in Nigeria you do or you abroad.
Absolutely, Isaiah is so right.
Doctor, the one I want to ask now. I'm asking two questions in one. The number one is, under what conditions should a man not have sex? One. The second one is, for some of us, this is practical. We don't at the experience sometimes, when you go date that play two, mozo poo go yoko hold you for leg.
Yeah.
That mozo poo, is it related to any of this kind of matter?
So finally, you not agree with me. You not agree with that sexual activity while pleasure is physical exertion, isn't it?
Bro, if I
significant input of energy.
Happen as well.
Not treadmill, is a treadmill.
Okay, so let me start with your first question. Do you understand? Yes. Are there any condition that a man will have that he shouldn't have sex, so you advise against sex? No, not just a man, a woman as well. Okay. Like I said, let's go. But I like making things common sense. Okay. We've said that sexual activity while pleasurable is physical exertion, stressful. You can have strain as well and stuff like that. I've given you a build of the kind of things that can be happening during the sexual act, isn't it? So imagine someone who has heart failure, or someone who has just had a heart attack, or someone who has one significant medical problem and stuff like that. Of course, it's advisable that hey, chill, be very careful. I either stay away from sex for now till you get better, or try and modify how you actually involve yourself in the sex act. Remember, I talked about that when two people are having sex, there's usually one person that's passive and one person that's active, isn't it? So when you're giving advice, your advice can range from in the meantime, while you're this ill, you're this unwell, okay, you can hold off with sex, or depending on how unwell the person is, okay, you can actually try and look at your roles, the kind of roles that you play during the sexual act and stuff like that. So that would be the general guidance. But of course, because you will always look at the index patient and what that patient's problem is. But baseline is that whatever a patient who has a significant medical problem, especially medical problems affecting your heart, your lungs, your overall physical stamina and condition and stuff like that, definitely you definitely give some guidance.
Dr. Oko, I want to ask you this question.
No, just before you go on this,
the muzzle pool matter. I never answered them.
Oh, the muzzle pool. Oh, yeah. So remember that I told you that one of the things that happen is that the increased tone, isn't it? And especially when you're having when the person is actually having orgasm and stuff, and the muscle can really go into tonic proper contraction and stuff. So you can have what you describe as that muscle pull or cramps, and so you can definitely have that. But is that directly related to in terms of having headaches in the brain or having a bleed in the brain? No, not directly. It's not directly related.
I have a question. I have a question, please.
Yeah, muscle pull can be normal depending on the person.
Yeah.
So let me just put it back. I'm sure we'll get to that in terms of prevention. Someone who exercises all the time, does a good lifestyle and stuff like that, is less likely to have muscle cramps or muscle pulls during sex compared to someone who is a little bit obese, and doesn't do exercise and very sedentary.
And they get muscle pull for football.
No, I'm just saying generally. I'm not speaking about anybody specific. I'm just saying generally.
Yeah, should I go on, Dr. Tony?
No, over to Dr. Agbons.
Okay, thank you, Austin. Doctor, you have said quite a number of things, but I'm just picking your analysis one by one.
No
So if there's this plateau, like you said, just plateau that you mentioned during the sexual act, so can we now say that people who are predisposed, like maybe having headache after sex and all that, can they just like do a little and not reach orgasm level, whether a man or woman? Just do small, then you relax.
Boss, how you go ask that?
My answer to that will be, first of all, Tony, I will say you're a wicked man. But my answer to that will be that, it depends on the person. But the full pleasure of the sexual act is usually orgasm, isn't it? So imagine trying to actually deny.
No, but without the headache that is coming after the plateau matter and just.
Yeah, I know. Yes, but the other option might be maybe you shouldn't just have sex at all. That's wicked, isn't it?
Yeah. No, I don't think this question is just to the women. Now let the cap you want your you go come out.
I say for the both side though, because that at orgasm the plateau is like this.
I know, but the key thing, especially for men, but for both sexes, that summit of pleasure, is usually orgasm, isn't it? The summit of pleasure is orgasm. So if you ask, if you're predisposed to having headaches and stuff, can you just actually have sex without actually having orgasm? Of course, the answer is that you can, but how many people actually want that in reality? Okay, so it's more of a theoretical question.
But Douglas, I think over time in marriages, most couples don't attain orgasm anyway.
The men do. The men do. Is the women that don't attain orgasm. But men, almost 95% of time, or more, men will attain orgasm.
That's obviously.
That might be a very good topic.
Sorry.
We don't arrange that question down. We get doctors who want to teach us on that.
Okay, I just want to ask another question, like a follow-up.
Yes.
From Dr. E.D. Charles. He's asking, I think Dr. Loretta followed that up as well. If you are having consistent migraine as a man, does it mean that you will not... Or woman. And now become a celibate? That will have some social implications.
So the key thing is that, remember, we've talked about migraine, tension, headaches, and stuff like that as a background problem that people who actually have headaches in sex can have, isn't it? Okay. Yeah. But we've also said that when you're actually having these issues, you should seek medical help. And the best person to see, apart from a GP or a family physician, is a neurologist. Okay, the neurologist will do all those assessments and all that, and actually find out, make a diagnosis. What kind of headache is this? Is it a migraine headache? Is this something that's more sinister? Should we do a scan to make sure that this and that? If by the time the neurologist goes through this whole this thing, goes through the whole all this activity to actually assess the patient, and he does a scan and they don't find anything significant, then he can now do his job, isn't it, and actually start prescribing medication that can help. Okay, so there can be medication that can actually help. There are some sort of weird and wonderful painkillers, some special drugs that the neurologist can actually prescribe. I usually don't prescribe those. I'm more of the cutting and doing operations.
The spanner and hammer matter. Okay.
Hammer time.
Yeah. Osage Binosu has asked a question. You know, sometimes for most of us men, we have sex to take stress away.
Yes.
And some stress is headache. And now you are also telling us that headache can cause sex and sex can cause headache. Please, how do we survive this?
Well, the key thing is that in terms of looking at the numbers or the frequency or the statistics, how many people will actually have headaches during sex? Okay, the number is not that great. To me, I think it's less than 2% of the population. You know, it's less than 2% of the population. So that's why I said this is not a talk to actually scare people and say, hey, stop having sex, so you have a bleed in the brain. No, it's just an opportunity for actually provide information regarding things because remember, especially culturally, sex is like almost a taboo to talk about it, isn't it? So you can imagine. I created a scenario for you. Imagine two people having sex, and then one of them actually has a convulsion, has headaches, and there's a tendency that the other person might be shocked and not actually move into action quickly because they're like, what people think and stuff like that. So these kind of platform that we're using to actually provide this advocate actually helps. So that number one, it's not as if everybody who is having sex is going to have headaches. It's roughly 2% or less. Okay, but the information is definitely important in terms of actually knowing what the sort of associated factors, looking at the predisposing factors, triggers. Okay, looking at what the symptoms might be like. If you do have the kind of symptoms, what do you do? And of course, I'm sure we'll talk about this very, very soon. How do we actually prevent this in the first place?
I think we should go straight to prevention.
I was just going to ask you.
Before we go there, sir. Before we go to prevention, because this is a very important. I'm talking about the practical matter.
Yes.
Now, looking at this matter,
practical.
Okay, you know the different style there for the other room. People have
yes.
different styles they employ. Is there a particular style that is safe for a man not to go into brain?
I've forgotten the word. There's a word they use. I know in local parlance they call it Papa Mama style.
Because there's Mama Papa style, which is
yes, exactly. So in terms of strain and stress during the sexual act, Papa Mama style is actually what will give you the less stress. Okay. In fact, there are some articles that looked at where they talked about the positioning. Okay, if someone is kneeling down, or what do you call it again? Doggy style. You understand? That's more stressful. We actually compare it to the Papa Mama style. So positioning, in terms of the roles that the two people are playing. Well, exactly. So hanging would definitely be more stressful, isn't it? So if you were to take all the people who have actually had headaches during sex, or people who have had bleeding in their brain during sex, people who are hanging would definitely probably be more than people who are doing Papa Mama style.
So
if that makes sense.
I've always argued, doctor. Even when they have program with your wife, I've always argued that though she don't destabilize me from that taboo. I've been made to understand. See, if woman are there on top, it lead to too many female children. But she don't.
Well, how will I put that now? You're talking about that's hyper health. Do you understand? That's above my pay grade. Yeah. I'm sure. I don't scientifically. I don't know if that makes any sense. But
no, Dr. Lota, don't toss in a lie. I don't hear that. If woman there on top, all those people when they get female children and women they do on top. If you observe,
I don't know about that, comrade. So all I'll say is no comment.
I want to ask this one. It's almost this question is very important, my brother.
Okay,
I don't go for better. You see, I want to ask this question. This hemorrhage, is there any scientific data to say that it happens more in the afternoon than at night?
No, not really. They've not gone as far as that. Remember, most of the things I've been talking about, I've been saying, that there's a theory regarding this mechanism and stuff like that. So they are still struggling with the theories of the mechanisms that actually causes mobility. Talk less of not going to look at the daytime variations of how things happen and stuff like that. But I suspect that the average Nigerian will say, this will happen during when the sun is really, really hot. But I don't know about that. Don't quote me.
So, doctor, this leads me to a different one. I mean, I know
Yes.
we've established that this matter men suffer more, and women are protected, because of the availability of estrogen. Is it therefore safe to say that women should always be on top?
Well, I've talked about this a lot, and I've said that when you always look at individual cases, okay, and I gave an example previously and said, looking at a 65-year-old man and a 30-year-old man. So let me add to that. Imagine a 65-year-old man who has some heart problem, is hypertensive, and is diabetic, and he marries this very fine, young 30-year-old woman. I would advocate that the 30-year-old woman is on top. But of course, a young, vibrant, energetic 35-year-old man with a 30-year-old man, please, any of them can be on top or any side, anywhere you want to be.
Okay, that's very good advice.
Okay, let's go straight to prevention, Dr. Douglas.
Yes. So prevention, the first basic thing that we would say about prevention is looking at the modifiable risk factors. Okay, healthy lifestyle. One of the key things I tell people is that once you get to the age of 35 and above, 35, 40, please really, really actively and proactively start looking after yourself. Okay, those are the periods when you should actually start going for this 6 monthly or one yearly health checks. You are doing all your blood tests, making sure you check your blood pressure, check your blood sugar, and stuff like that. That's extremely important. Of course, remember that a significant number of people who actually have health problems actually inflict it on themselves, isn't it? Smoking, alcohol, okay, eating, obesity, okay. So these are modifiable risk factors. So things that you can actually do to actually prevent those things that can actually predispose to having aneurysms and all that. Please do them, okay. And of course, we're talking about primary prevention, isn't it? The secondary prevention as well. Secondary prevention means that when you're actually having something happening to you, either be it on the benign end of the spectrum where you're just having headaches during sex, or to the sinister, more complicated part where you're actually having a bleed and stuff like that. Secondary prevention means doing something about it, not staying in your house or whatever, going to actually see the doctor, making sure that they're actually investigating, assessing you, doing scans if need be, starting your medication if need be, and stuff like that. So that's sort of secondary prevention as well. Of course, there are two key things that I must talk about before we leave here, and they're just common sense stuff. Okay, I'll talk about them again. Sex position and styles relating to the couples themselves. Their age, their stamina, their strength, whether they have comorbidities like other medical conditions and stuff like that. And also practically, either looking at the two individuals involved in the sexual act and all the other things I talked about, and whether they're playing passive or active roles. Does that make sense, or do we go too big?
It's I think it makes sense. Well,
yeah. So just to break it down: healthy lifestyle choices, okay, sex positions and styles, and looking at the roles that the two individuals are playing, with regards to the sex act as well.
Thank you, Dr. Oko. Thank you very much. I don't know. Even though I'm on this program, I've learned a lot today. A lot to take home.
I have a contribution.
Yes.
Go ahead, sir.
Yeah. Thank you so much, Dr. Douglas Emeka Oko. I can see that our chat is really buzzing, and I think we can go on and on and on and on. But two things I want to say, which I've taken off from here, you can also help as well. I think traditionally, sexual activities in Africa is a bit different compared to the West. In the West, from my line of practice being in community, the female folks are relatively active, and there is that support therapy. So for people that are listening and yourself as well, it may be a good idea if we have huge amount of money to do a research with Africa and Caucasians to see how participation is among male and female. That would help to also at least create that education. So if our viewers are listening and you are having your PhD or you have access to funds for research, please let us think about that as well. And also too, in my line of practice as a community pharmacist, I've seen often more young people coming to buy things like sildenafil, which is Viagra. Most times, what I found out, 4 out of 6 people that I sell this for, are actually involved in extramarital affairs.
Mm.
And like you said in the course of your conversation, there is a high level of fire up. So if you've got somebody, you want to impress the person with limited time, it may just create more preposition to you having any sort of untoward effects such as aneurysm or even brain hemorrhage in the act of sex. So it is a lesson. If we can stay away from it, let us try as much as possible so that we don't fire emotions and stress. And like our viewers, majority of them would know, Viagra in itself was actually discovered as a blood pressure medication. It was in the course of having people test for it in the first, second trial that they were now reporting information that they were having erection. And that's how Pfizer converted that drug to become an erectile dysfunction tablet. So when we want to give it out, the first thing we ask is all those questions, and especially people that are taking drugs that have nitrites. We normally don't want to give it to them because that could also help the firing line and cause all that.
Thank you very much, Austin. You don't speak many grammar. But let me just quickly remind our audience, we have just about 5 minutes or so to round off with Dr. Emeka Oko. Please, if you have a question you want to ask, you want to call in and make a contribution, you can. The number is displayed right on screen. And I just want to ask, Dr. Oko, the one, I'm sure we will play around for this last 5 minutes. Doctor,
yes,
there are a number of our people when it be say, in these days, I think in one of the classes where we still do concerning all this kind of matter, we were told that what they call them sex pays. You understand what I'm saying? And increasingly, we are seeing more and more people. I'm this surprised right now. As a lot of Nigerians are now taking part in blue film. You understand? And some people are even consulting, some people are in the process, they are converting so many. So it therefore means that with what you talk, so it's important for anybody when they hope to go and take part of blue film, make it check how it be first, particularly for this brain matter, before you go. That should be the advice, isn't it?
No, definitely, absolutely. If you're going to be doing a job where
sorry, we have a caller. I want to believe this person is calling because of the hello.
Hello.
Yeah, hello. Good evening, ma'am.
Yeah, please. When it's time for contribution, so I'm watching the program.
Go, you can contribute now. You can contribute now, ma'am. What is your name and where are you calling from?
Okay.
Go ahead.
Let me put down my volume. My name is Yare, and I'm calling from London, and I happen to be in the community pharmacy. So there's something I would like to, with this through this medium, to say, if you can emphasize on it. Because many people come to the pharmacy, especially the black men, and they want to buy sildenafil or Viagra Connect. When they come in and you ask them, oh, are you hypertensive? Oh, no. Have you got this? No. They hardly accept medical conditions. So it will be a good thing if it can be addressed here, touch on it, so that men don't need to be ashamed of speaking out. So I'm very happy when I heard one pharmacist talking now, which was a very good one. They come in and you ask them, please, there are some questions I might want to know from you. They say no.
Okay, I think summary.
So that's my contribution.
Thank you very much, madam. God bless you, doctor. You got that.
Yeah, I think Iyari makes a lot of sense. Fundamentally, as from where we come from, Africa and Nigeria, we have key issues with health-seeking behavior and actually being truthful in terms of representing, what if we have medical conditions and stuff like that. And let me just say this very clearly, ladies and gentlemen, it is extremely dangerous for you to engage with any healthcare provider, be it pharmacist, doctor, and stuff like that, and not actually tell the truth about your medical condition, whether you're actually going to have a treatment or have a drug. Extremely dangerous. Please, You understand? Tango, we say that, man, that culture is dynamic. Okay, that part of our culture, we need to do more advocacy and do some more health promotion and education to actually tell Nigerians, Africans, I mean, hey, please, you understand? Stop hiding this. It's especially from healthcare providers. It's extremely dangerous, very dangerous.
So while we have 2 minutes to go, Doctor Bahano, one I get question. I still get small equal here and there.
No, the only question I have, this question I have is, you know, we're talking about style and all that. So this question has been on my mind. I was just waiting for this time. You know, there's these new ways of sex now. These people want to come and not come and come and not come. So this one that they are calling giving of head and all the rest. Doctor.
Cunnilingus, that's what they call it.
This one that they put mouth so that man can come. How does it affect this topic we are talking about? Because that one is another very hard one, though.
Well, let's look at it this practically again. Okay, the only cunnilingus where, like you said, maybe the lady is giving the man head and stuff like that. Usually, the man is just lying down, not doing much in terms of the physical activity of trusting and stuff like that. So when it comes to looking at physical exertion itself, you know, that act of physical exertion, looking at the roles, either be passive or active role and stuff like that. I think there's the amount of physical exertion that the man, like we're talking about the woman giving the man head now, or the cunnilingus, isn't it? The amount of physical exertion that is going on there from the man's point of view is actually less, you know, compared to actual coitus, especially if the man is playing the active role and being on top, or wherever he is, side, up, down.
But orgasm can be controlled, isn't it? Can't men just practice how to control their orgasm?
Oh yeah, definitely.
It cannot lead to
definitely. So that's the play two phase, isn't it? Men can actually train themselves to actually extend the play two phase, and of course you don't blame them, isn't it? When you hear things like 1 minute man, 2 seconds man, and stuff like that. So you know, men, they try. We as men, we try and show our muscularity through the amount of time that we can actually spend doing the sexual act. So yeah,
give you what you've just said as a follow-up.
Yes.
Are 2 minutes and 3 minutes men safer for this matter?
In theory, yes. In theory. In theory.
So, I mean, I think the advice is that if you be 2 minutes man, not the shame, because if you have this brain problem,
it depends. It depends. You have to actually look at the index couple and what they like, isn't it? Because I don't know. Because the best thing to happen in terms of pleasurable sex will be that the man and the woman, that both of them enjoy what's happening, isn't it? So the question will not be, let's not think about the man too much. Think about the woman. Well, on an average, how many women like 1 minute men and stuff like that? So when we're talking about the sexual act, we actually look about the two individuals involved.
I think that is where the trouble is. Doctor, we don't come up for your professional line now. Now that the trouble
I tire for you.
Because a lot of people really.
I'm supposed to be talking about the brain.
We want to turn our consultant neurosurgeon
but just to say, Douglas, what I find out, this 1 minute man and 2 minute man doesn't really happen in a regular relationship. It is more of those extra that you are trying to impress.
We are really excited and are trying to impress.
Yes, because if you've been married for a very long time, your partner really understands your strengths.
Yes.
And it can work with your strengths. But most of us 1 and 2 minutes are a way back.
Pharmacist Remiran, speak for yourself on this subject matter. Speak for yourself. Because no, this is serious. No, this is serious.
Yes. Tell us, Comrade. Tell us.
I visited a friend. Okay, his own friend came to see. Their family friend came to see his wife, and the discussion the family friend was having with his wife was his husband not the try at all. He don't advise and he don't do everything. You understand what I'm saying now? And the way they be now, he want come out. This 2 minutes matter is rocking marriages, my brother.
Really?
Yes,
I'm telling you. What do you think? I
think gentlemen, what I would say is that Comrade has a very, very good point, looking at some index cases and stuff like that. But I think what Austin was speaking generally, and if Austin is speaking generally, if I'm correct, Austin, please correct me if I'm wrong. If you're speaking generally, Austin also has a very strong point as well. You understand that?
No, he's using his own family case to. No, your family is.
No,
He's speaking generally. Correct me if I'm wrong again, Austin. I think he's speaking generally. I don't think he's using himself.
So
I'm speaking generally.
Okay.
Comrade, are you trying to put Austin on the spot? I don't understand.
No, I know. I think he should speak for himself. When you go say, men and women, husband and wife, they are okay. No, not everyone is okay. Let's take
No, I think he's very specific about in terms of the length of the sex act itself.
Hello. Let's take a call, please. Hello.
Yes, it's really Yari. I'm telling you guys, I'm one contribution to this 1 minute second.
Go ahead, man. Go ahead. This is a woman's perspective from 1 minute seconds.
Yes, very important. We need to hear it.
There's something I want to talk from my pharmacy background and from pharmacy's point of view. What I will contribute is that look, so like programs like this, more women to be invited to watch them because why? 1 minute seconds, 2 minute seconds, I don't know men. Men should be encouraged to have confidence in themselves because many men have died as a result of women. Like the result of now that a friend came and was discussing my man fire. All these things are fake. Women lie a lot. Medically, when I see my fellow women, I know their age. I know their hormones is already diving. So no matter what they tell me, I don't care about them because I know them medically more than they see themselves. So men should be called to programs like this to get encouragement and for men to speak up. Because there is a guy I knew, he died as a result of Viagra, which he was not supposed to die because he was hearing from my man, not they did do anything, and not they sleep with them for nothing. How many men they did sleep with their wives? And how many women they talk to? That is the truth. So men should be invited to programs like this, let them come and listen, and then build confidence. I think that will help, speaking out. Because I get angry when I see men dying as a result of Viagra, and the women are dead. And when this man dies, the woman will go to another man, still looking for another 100 seconds left. Where will they get it? So they should learn how to manage the 2 seconds. If a woman cannot manage 2 seconds, let them go.
Thank you very much, madam.
Thank you so much, madam.
God bless you, man.
I think
that's a very
I think Madam Yari makes a lot of sense. It just goes back again to the cultural issues of us not being truthful with ourselves, of us not speaking out in the appropriate. But speaking out doesn't mean you just go anywhere and start talking about your problems. There are experts, people who you trust. Hopefully, you do trust them. They can actually discuss them with. But remember, when a couple has.
Sorry, sir. I think we may have another caller. Hello.
Please go ahead.
I want to contribute. I want to ask Doctor, is anything wrong for a man to give a woman head? That's my question.
Okay, so my answer to that question will be simply that two couples, they should do what they think is best as long as it's safe. As long as it's something safe. In terms of the sexual act and the different things that people do, there are some things that are actually very dangerous. Okay, a man giving a woman head is not dangerous. Okay, so if a particular couple feel that that is what they want, as long as it's not dangerous, why not go for it? No problem at all. It's up to the couple. From a medical point of view, there is no big issue.
But in cases where sometimes a woman wants head, and the man says, "I'm a traditional man, not they give head,"
then that is their own. That is their own palaver.
Or the man wants head, and the woman says, "I they give head to my husband, I'm not going to give her to man when they're outside." I mean, this can be.
So those are more of peculiar issues to the personalities involved. Okay. The key question, if I understand the caller, is from a medical point of view: is there anything unsafe, or detrimental to health with a man giving a woman cunnilingus, oral sex and stuff like that? Absolutely not. Again, I would say it's up to the particular couple involved.
Thank you very much, Dr. Oko.
Yes. One last point, Dr. Agbons, and thereafter Iremira. Then
no, my last point is just to thank our consultant neurosurgeon. The man that goes with the hashtag "the Nigerian patient are worth it." You have educated me, and I know you have educated a lot of people globally today. Always a pleasure to listen to your presentation like this.
We're having another caller. We're going to take him. Hello.
You know what to do.
Hello.
Yes, hello. This is calling to Sazuwa from Ojo Norway.
Go ahead, sir. Mr. Sazuwa.
Yes, sir. First of all, I just want to appreciate you guys for what you are doing. Yes, thank you, sir. My question is there any special way a man can actually satisfy a woman that has never get to orgasm?
Wow. Thank you, Mr. Sazuwa. Thank you.
Okay, Osazuwa, difficult question. The truth is that in reality, gentlemen, and of course, the audience, the number of women that actually get to that level of orgasm during sex is actually definitely not as much as men. In fact, from the feedback, from most of the discussions I have with people, a good number of women actually don't actually have orgasm. A good number percent as well to actually make their manfolk happen. But generally, okay, the issue of looking at the initial arousal period, excitement, and then moving up to the plateau and stuff like that. That initial bit of excitement and stuff like that, I think one of the ways to actually help to actually make a woman come to orgasm is actually the foreplay thing. That really helps. Okay, the foreplay thing. Also, the cunnilingus or the oral sex that the other lady was asking about as well can also help. Okay, I just feel somehow. I'm supposed to be a neurosurgeon, but they're bringing me straight into being a sexual specialist.
Anyway, doctor, you don't try. We go treat all this topic. No worries, Sazuwa. There's a day for it. You just follow the Comrade Show.
Yeah.
Click the notification button. We go. Don't worry. We are coming there. Not be health matters. Pharmacist, your last word for the doctor, please.
Thank you so much. But I will not leave without putting a word for Osazuwa. I think what I've also found out being in community, couples don't really discuss. I think sexual issues and act of sex should be discussed among couples. So when you discuss that, you can find what makes one happy and try to aim for that satisfaction. That's just my suggestion on that. But I just want to say that I'm so happy. Today happens to be one of the greatest days of Comrade and Friends. We're really buzzing. Dr. Douglas Emeka Oko, you are special. Thanks for coming to enlighten the viewers today. And I believe we've touched with your presentation today and your discussion, we've touched one or two lives. I just want to say thank you on behalf of the team.
Yes. My people, Nigerians across the world, thank you very much. We've not been alone.
Last word from me. Any last word from me?
We are coming to you, doctor. We have not been alone. We've been with you guys. Your contributions, your questions, your everything made this, what it is. And of course, we cannot end this section of this program, without saying a very big thank you to Doctor. And Dr. Oko, I want to believe and hope that whenever we call on you again for another topical issue that concerns the brain, your area, where you use a hammer and chisel to put things together and correct, sometimes craze and many things, and that you will definitely oblige us, while we are saying a very big thank you for the time you've given us today. Any last word, Doctor, to the people?
First of all, I'd like to say a very big thank you to Comrade and Friends, Comrade Lamte Oriaki, Tony Agbons, and Austin Haemorrhage. You guys have been doing an absolutely yeoman's job. Continue doing what you're doing. The whole world is watching you guys. You guys rock. For me, the passion for actually pushing the boundaries of trying to actually reform the healthcare system in Nigeria is something that is very, very, very close to my heart. And that's why I actually left this nice United Kingdom, actually went back to Nigeria to try and see what I can do in my own small way to actually start pushing that. And I'm glad that you guys are using this platform to actually try and push that as well. One of the things I'm really passionate about is advocacy and actually providing information for the average Nigerian. They say information is power. And I will continue to do this. God give me strength and give me health, because like I always say, the Nigerian patients are worth it.
Thank you very much, Dr. Oko. Of course, the Nigerian patients are worth it. And of course, God will give you long life, to continue to do what you are doing. And of course, fulfillment in your family and everything for what you do, because Dr. Oko has actually done a lot to support the Nigerian patients everywhere, and he's always available, to talk to, and of course, to contribute in whatever way he could. So we are very thankful to him. Thankful to you guys. So we've closed this segment right now. We quickly move into a different subject matter. Nigerians, I think it's happy days for Nigeria today. Not because of politics, not because of so many things happening that is making Nigerians divided, sad, or happy, but because the super egos of Nigeria, they are appearing now as the only unifying factor, genuine unifying factor for the Nigerian people. Everybody from north to south to east and west, across board, everybody is happy to and proud to be a Nigerian today. The reason is because the Nigerian Super Eagles has qualified, literally, practically, for the next stage of the Nations Cup, beating Egypt, highly rated Egypt, a goal to nil. And yesterday, they made a mess of Sudan, 3-1. Should have been up to 5 goals. Dr. Agbons, how proud are you today to be a Nigerian?
We have a call.
Let's take this caller. My finish name with Oko.
Okay.
Hello.
Hello, sir.
Yes. Good. What's your name and where are you calling from?
Good evening. My name is Mr. Suleiman. I'm calling from Auchi, Edo State.
Go ahead, sir.
Are you calling to ask about the sex?
To the doctor that just finished talking about sex, it was very an enlightening discussion, having men to know what is obtainable for them not to get brain injuries and all. I want to thank you. We have been following the show, and we want to say a very big thank you to the organizers of the show. Also, because we just finished the sex discussion and we are diverting, I just felt that it is necessary that we also draw the attention, because a lot of us are listening to the show, and we're hoping that some discussion that is around social media, particularly in those states, this period is mentioned. Over the weekend, there was this video trending on social media about one new Edo State commissioner, the content of the video is being generated, mixed reaction. A lot of people have been talking about the reaction. As a frontline program of the people, what do you guys have to say about the video? I don't know if you must have seen the video about a commissioner that nominee for the Obaseki administration. So we just want you people, because your show is like one of the ones we listen to that we get enlightened about political situation, football, and all. I just feel that it is necessary that if you guys talk about the show, we can also get enlightened from there.
Anyway, my friend, thank you very much for drawing our attention. It's all right. Thank you. We've taken note of your, of course, your contribution or your message. I think he's referring to one video. I think a lot of people have been sending me that video. One, a commissioner nominee by the governor of Edo State. The daughter of Yisa. One lady who appeared to be talk. I think I've got that video.
Yeah, Comrade Lamte. I think this is not on cue, but it's the people's show, and if anybody has raised concern, I think we can have a word or two about it and just look at it. I don't know if you have that video.
Yeah, it's true. Why the comrade is trying to look for the video, pharmacist Remira, I think I support what you said. We'll hang the issue of African Cup of Nations, and like you said, as a people's show, we quickly talk about this matter. Yes, it's a very good issue.
Yeah. Let me just download it from Facebook right now and get it on.
Yes. Why the comrade is doing that? Pharmacist, I just want to.
Have you guys seen the video yourselves?
Yeah, I've seen the
I
video.
saw it. I saw
I
something.
saw the video. Somebody, it was in my one of the WhatsApp group I belong. I saw it there.
Okay, I got it now. Okay, I think I got it.
Okay.
Yeah, let me upload it here now. Okay, we are not going to spend time on this. We just do one, go one round on it, and whatever, and then we move on to the matters of the Nations Cup. So Nigerians, please, let's watch this video. This is what this scholar was referring to.
Honorable. Oh my God. Till we hear something. Benin ain't seen nothing yet, man. This is your newest Honorable Afibrimo, Commissioner, the latest commissioner in town. We're behind you, man. We're going to give them some fashion style. I trust you, all the English in the world. Afi, will they hear you when you speak in Benin? How will they understand what you're saying? When it's all Oyibo?
I want to try and learn their language and try and make sure that we can communicate.
And if you can't communicate with them?
Oh, we will.
I trust you. Senator Issa Brimo's daughter, I trust you.
We will.
So this is the newest one to our family. Afi is now a commissioner. She's going to serve Edo State. And you trust me, I went to school in Edo State. I'm going to be there right here. I'm going to be by her side. If you come near her, I'm going to punch you. Congratulations, babes. Welcome to Nigeria.
Dr. Agbos, what do you think?
Yeah, like I said, I saw this video yesterday. And thank you, our caller from Auchi, Edo State, for even phoning in and talking about it. This is what we have always been saying. This is what some of us have always been saying. The social media going wrong. You see what has happened to this Edo State Commission is a misapplication, of excitement. If I'm going to even connect it to the brain hemorrhage we were talking about a while ago. Yes, you have been made a commissioner designate. You don't need to go this far. And if I thought you want to go this far to have, because we all have private discussion in our house, you don't have to do a video. Because this to me was just a private brag of a young lady who have been made a commissioner designate, not confirmed yet even, and doing this. It's part of the thing we are talking about, that people should be very, very guided as to what they do and what they put on video, because somebody can hit a button and that is it. And that is why this video has been trending since yesterday. And I don't think it's very, very good for her. But like I always say, I believe that this young lady would have learned a very hard lesson. That is what I have to say, my brother.
Austin Remira, what do you have to say concerning this video?
Thank you so much, Dr. Tony Agbons. I saw this video yesterday, but I never considered it to be very important or relevant until Suleiman from from Edo State called in to express concern and wanted us to talk about it. But quickly, I have a few reactions to this. I think, one, the lady in that picture, who I understand is a commissioner designate, that whose name has been sent to the House of Assembly for ratification, may not be aware of what has happened. It could be that this message is coming from the friend. But if she's directly involved and she's aware and allowed this to go out, I think that's a wrong error of judgment. And as her name is being sent to Edo State House of Assembly for confirmation, because it's the designate, I would expect the Edo State House of Assembly to do a very thorough job and be sure before approving her name to be a commissioner. Then on the part of the governor, I understand that this is a daughter of a former senator from Edo State. You will agree with me that probably this is one of the reasons why it took such a long time for the governor to come out with the list, because he might be under so many pressure. I'm not saying that relationship, friendship, and cronyism will not be a part of governance, because you need to know somebody. But if this is coming from the dad and he has mounted pressure on the Edo State government and the lady found her name there, that is not good. That is nepotism in itself. And I think this happening is a leeway and a good way for the Edo State House of Assembly to do a proper job. I must also say, because a few of my friends have said she's coming from the diaspora, I don't see any reason. You can come from anywhere. So long as you have affiliation with the Edo State, what is important is capacity. If the person has got capacity and is from Edo State, even if it's diaspora, even if it's from Ondo State, even if it's from Lagos State, he can come and serve our state. All we want is deliverable. But again, Sule, thank you very much for raising it. This is out. We are putting it forward. Hopefully, those in government will look at it very carefully. And let me warn Afi, Edo State is a place for dedication, seriousness, and commitment. If you know you lack this, it will be good for you to do a withdrawal yourself before the Edo State House of Assembly do the needful. But that's just my contribution for now. I don't see anything so bad. Let's be careful. Social media is never forgiving. That's my contribution, Comrade Lamte.
Thank you, my brothers. Thank you very much. For me, I think I probably have a different view now. I saw this video. Somebody sent it to me yesterday. More than 20 persons have sent this video to me. More than 20. I've had cause to watch this video. When I saw it the first time, I was livid. I was enraged. I was very angry, to be very honest. Seriously angry. But I had cause to watch it over and over again. And I think I did climb down tremendously from my anger. And I've looked at a lot of things and balanced them out. When I saw this video, I found out from the footage, first, that the person who carried the camera was interviewing me had been live on Facebook. This girl appeared to just be coming from outside, entering the compound, probably coming down from the car. Okay, let me put that image again so that we can have, some balanced view of what I'm saying.
Honorable.
Probably coming down from this car, okay, and she's quickly confronted, with the camera of a friend or whoever, or a family member. She looks tired. She's not prepared for any constructive gist. Apparently, she's excited. She wants to impress her friend as well. Purely private thing. She's trying to walk into the house. She's trying to walk into the house. And her friend is engaging her with the questions, with the excitement. She responds on her way into the house. Now, that doesn't look premeditated to me. To that extent, this could happen to anybody. And I no longer think that these, speak to anything, of competence as far as she's concerned. Again, the reason why, I came to this judgment very late last night is because no matter how the lobby is, we have looked at Senator Yisas Brimo's daughter. No matter how the lobby is, Governor Obaseki is not a man who will employ anybody who is not qualified. I think he has proven that to us over and over again. So even if you are lobbying, he expects you to submit names of people that have very good resume. I did go to check a bit around this young lady. I finally settled myself when I read a little about her. That she appears to, she brings something to the table as far as governance is concerned. So this is where I really fought her. Probably what elicited my anger was when she said, "I will try to learn their language." Okay, I think that may have been misguided. Okay, whether privately or publicly, as it were. But I don't think we should be too emotional, about this, too emotive about it. I know that a lot of people that are taking the matter up publicly right now, many of them maybe just be those who want to pounce on the governor and the government and all of that. But I want to believe that this is forgivable. It's not such a damage that should challenge our competence. I really agree with Austin. The House of Assembly should do a thorough job to screen every nominee and ensure that, yes, they bring something to the table as far as this matter is concerned. On the issue of the father being a politician and people are squeezing themselves into this is what definitely we see Nigerian politics to be. And somehow we may not be able to change anything much on that aspect from the stable of the Comrade Show. People have a way of, lobbying to ensure that their own ended there. But I think that I give kudos to the governor, because the governor will always ensure that qualified people are the people he's working with. So to that extent, let us wait and see what happens. That will be
We must thank Sule for that, for bringing it to the
yeah. Of course, I thank you. I had no intention of talking about this matter at all. I probably had earlier when I saw it yesterday, but later after watching it over and over and over and over again, and I began to see the metrics behind this matter, that it doesn't look premeditated to me. It looks like someone who's just coming and is just confronted by this, excitement matter by a friend, and she's on her way in, and all. You could see even the end of the video. Look at it.
Yeah, and like I was saying, comrade, let us all be careful with our mobile phones. What we record, it's very dangerous, because people just take mobile phone, they record, and then they hit the send button. This is what leads to all these things.
You see the way she departs.
Yeah, I must tell you, yeah, everybody is throwing stone at her now. Yes, she has heard, but some of the things some of us even say in our living room with our friends that we don't record, some of them could even be more than this. So, like they always say, they say na person will carry belle, na go do something, isn't it? So
yes, it is.
I feel she will learn from this.
Yes, it should. Well, let's go to African Cup of Nations. Nigeria, Agmons, you were on your feet.
Yeah, thank you, my
6
brother.
points from 2 matches.
100%.
4 goals scored, 1 goal conceded.
100%. And as a strong Edo State man, kudos to the master tactician, our son, beloved son, Augustine Guavon, for the deliverables. In less than 3 weeks, he has transformed the Nigerian team. So much energy. Psychology. Yes. We played Egypt. Mohamed Salah. It was as if he was not in the game. He was complete. He didn't even have a look in. So, and yesterday we smashed the Sudanese, and we are in the knockout stages already. I see the cup coming home.
It's coming home. Austin, what do you think?
Thank you so much. I just want to start with a warning to the NFL for anybody in charge of Nigerian football. I heard Augustine Egbavo is just an interim coach. May I dare warn that he should be given the job permanently. And I will go to the sweet part. I'm buzzing, I'm happy. Again, the glorious days of Nigerian football is gradually coming back, because we lost it a few years ago. That game actually, in my mind, ended actually 3-0. The one goal that came was just a fluke. Kudos to the boys. I want to see them go and top the group with clear 9 points, and I know they will certainly crush the next opponent. And like Dr. Tony Agbons has already said on the show today, the football is coming home, because the Grandmaster, Augustine Egbavo, is at the end of affairs. Congratulations to Nigeria.
Thank you, my brother. Thank you. I did check around, different pages across, social media and all of that. I mean, there is nothing that is uniting Nigerians more today than football. I saw a group of my Igbo brothers, my Biafrans. I saw a mammoth number of them celebrating
unity,
the victory of Super Eagles. At that point, nobody is talking about I am Biafra. Everybody was talking saying I am a Nigerian, proudly and happily. From the US, I saw a gathering of some Yorubas, some Oduduwa brothers, celebrating massively. Alaba, the Real Madrid defender, David Alaba, his sister was, he's from Austria, okay, but his dad is a Nigerian. The sister was celebrating, to the high heavens, the victory of Nigeria over Sudan. I was seeing, while the euphoria of this victory was ongoing, what I was seeing was unity. And the flip side of it is a sharp contrast, a political division, insecurity, inept leadership, bad leadership and bad followership. And I think we will find a way to speak to this, and see if the spirit of football can actually translate into true and proper patriotism for the country from the political spectrum. Anyhow, kudos to Nigeria, kudos to you and I, and kudos to the boys. And for Estine Guavon, I hope he plays the final of this competition. I hope he brings this cup home. I probably think that if that gets done, the NFF will have a rethink. They probably hurried too much to go and sign that Uibo man.
Absolutely.
Yeah. And one thing I've seen with this AFCON is that 15 of the coaches are actually Africans, which is a far departure of what we used to see. A lot of these African national teams used to have foreign coaches. So I think our people are now beginning to appreciate what we've got. A lot of our African coaches, they are good, and they should be given this job. In fact, people are already saying that if Austin Guavon goes on to win this cup, or even if they don't win it, God forbid they don't win it, but with the performance, the way these boys are performing, he should actually continue. We just tear off that contract.
My brother,
we will not give you again.
Dr. Agbons, if this Super Eagles gets knocked out from the next stage of this competition,
yes,
I think Guavon should still be kept because the spirit he has infused into this team.
It's true.
I was looking at these boys.
You did say, before you go, you did say God forbid.
Put God forbid.
No, God forbid, my brother.
Thank you.
Now, what I saw, I was seeing a replica of
94
the USA 94 boys.
It's true.
Yeah. That's what I was seeing. So whether they come out or they carry ammo, I think that there's a new spirit in town and there's a new sheriff. Under 3 weeks, my brother.
Yeah.
What do we call the talk now? Under 3 weeks. So I think Austin Guavon needs to remain. Even though it doesn't remain, they've said that he's still the leader of the team. The coach is going to be under him because he's the director of
yes, the technical director of the
technical director of the team,
yeah,
and all of that. So kudos to Guavon. So Oh yes. I'll have to deliver that message. So Nigerians, congratulations to you all. Please let's keep watching Super Eagles. The next match is against Guinea-Bissau. The day hang morning.
Who's I check it.
I wasn't very happy. I think Guinea-Bissau were robbed. They were not supposed to lose that match against Egypt.
It's true.
They were robbed.
Yeah, yes. They scored a fantastic equalizer yesterday. It was chopped up. Yeah, it was disallowed.
Oh.
Yeah.
Anyhow.
But Cameroon, they are looking strong as well. They've got 6 points already.
Oh yes. In fact, somebody was making a prediction to say that
Nigeria Cameroon finals.
Finals.
Who was making that prediction? Somebody made that prediction.
But we pray that Cameroon should be knocked out. They always give us problem in final.
Yes, yes, that's true.
Cameroon beat us 1988 finals, 1984 finals, year 2000 finals. So Nigeria, we have 3 AFCON. If not for Cameroon, we would have had up to 7 already.
Absolutely. The last one, remember, scored a goal that was not allowed.
Disallowed. Yeah, penalty kick. Yeah,
the penalty kick was
Cameroon. They are just an albatross to us.
Anyhow, well done, guys. So the Nigerians, man, it's been a Comrade Show. What can we say? Thank you very much for the support we are getting. Please, if you are not yet following the Comrade Show, you've not subscribed to the Comrade Show, please do. What we discuss here, are normally things that will make our nation great again. We are very focused on Edo development and, of course, Nigeria as a nation. And we don't do any other thing. All that will make us better people, better state, better nation is what we discuss. So if that interests you, feel free to join us. Follow us on our Facebook page, subscribe to our YouTube page. And let's keep doing it. Let's keep rocking it. But we are all in this together. One for all for one. And of course, all of this is definitely not possible without the team of the Comrade Show. People I am indebtedly grateful to for what they've been doing. And of course, we've had today Dr. Oko, who has, made today very wonderful. I'm sure a lot of us have learned from it, and of course, in rounding off his own discourse on the issue of sex and brain hemorrhage, he did say that we need to change our life, look at our lifestyle. It's very important. People should look at their lifestyle. If you are the one who drink a lot, you smoke a lot, you womanize a lot, some of these things may not be good, for your health. So we probably need to, make swift changes. to those things. Smoking is not good for health. Drinking is not good at all. So these are some things we need to look into. And at the end of the day, if you are a better man, I'm a better man, everybody is good, we'll have a better society. And that is the truth of the matter. So we have a lot of issues we're going to be looking at in that, particularly as it's got to do with health. But we're going to be taking them okade, small, and all of that. But we are very thankful to you. Dr. Agbons, I want to say a very big thank you for being part of this program. Thank you so very much, my brother.
Thanks, my brother. Thank you very much.
And my brother, comrade, pharmacist Iremiran, come on, what can we do without you, bro? Honestly, we are grateful to you and thank you for being part of this show today.
Thank you, Comrade Lamptey. Daniel Aigbe as Christian Youth Chief Ego of Hotel Jordan. God bless you.
Yeah.
Okay, Daniel Aigbe, thank you so very much. I don't know where that is coming from.
With the way you are mixing Edo and English together like Chifigo is.
Okay, like Chifigo does. Chifigo actually is one of those our own icons I respect and I love so much because he does it very naturally, and I think I take this as a compliment. Thank you so very much. I appreciate that. So Nigerians and Edo people across the world, thank you very much. On the last note, I want to remind all of us, let's sleep with this, particularly the Edos in the house. Next month, February 14th, I think, we are going to be having a Queen Eden Day. It's a day of love. With the Edos, a lot of us are coming together to say we want to christen that day Queen Eden Day. But leading to that day, we're going to be talking to a lot of Edo people to tell us again the story of Eden, pure sacrifice for love for a people who put the state first before them, people who put others first before them. And so Queen Eden is very symbolic and significant. We will be talking much about this as the day come by. Thank you very much. It's been a Comrade Show, and my name is Comrade Lamte Imonsa Orehi. I'm signing out. Bye for now. I'll see you when I see you.
Make Comrade Show with Comrade Lamte Oriaki live on Facebook and YouTube. Like us, follow us, and be the first to know. This is the Comrade Show.